Bonsoir et bienvenue dans nos programmes News Extra. Dans ce programme, nous avons des sujets principaux. Pour commencer, nous comptons plus sur l'étude que le ministère de la Santé a fait concernant les maladies cardiovasculaires et les autres maladies non transmissibles. Bis à l'étude, c'était pour évaluer les facteurs risques dans la population cécile. C'est Dr Pascal Beauvais, consultant pour maladies non transmissibles, qui te présente les résultats de l'étude.
Drinking frequency, here is a number of drinking days where people drink per month. This is 20 days in red, 10 to 20 and so long, and in blue, in dark blue is 0 day. So if you look at the total population, there are around 40% of people who do not drink at all. So they're abstainers or ex-drinkers. And here you can see quite a few people drink a few days. Probably not that bad. Some people drink on many days. This doesn't say it's harmful because they can drink just one beer every day, or they can drink 10 beers on one day. But just to show that drinking frequency is pretty high, but it's many people not drinking at all, some drinking a bit, and a minority drinking very often. Here it's a frequency of drinking, prevalence of people drinking more than 5 for males or more than 4 for females, standard units. Basically 5 Sebrew, 5 glass of wines, 5 shot of whiskey. Or, not and. So here it's those who drink the number of days drinking more than this harmful amount. This is definitely harmful. And you can see this is more than 10 days per month. So you can see there are around 5 to 10% who drink this harmful amount on more than 5 or 10 days. And again, quite a lot who do not drink at all. For obesity, men of high socioeconomic status tend to be more obese than men of low socioeconomic status. For women, it's a reverse. Women of high socioeconomic status are much less obese than women of low socioeconomic status. And again, a trend that had been seen consistently over the last 20 years. So this kind of findings really makes us think what is the meaning of overweight in the mind of men and women. And there's many things to be said behind this in terms of what obesity means symbolically for individuals. Here it's a comparison of or the association between measured body mass index, the real weight, and perceived weight, how people perceive. And again, to make a long story short, this shows that a large proportion of people with obesity, too big, too large, think they are normal or just a bit too high. So they have a belief that things are normal. And inversely, many people who have a normal weight believe they are too lean. So basically suggesting that social norms on weight in the population are set quite high. It's normal to have a heavy weight, to put it very simply and shortly. And it's not normal to have a lean weight. That's the reason many people with lean weight want to gain weight. And those with high weight do not want to lose weight. And that's a very important finding because you can do whatever you want, but if people don't want to lose weight or want to take weight, it's extremely difficult to convince them on the contrary. Large body mass index, to put it in other words, is strongly associated with nearly all cardiovascular risk factors. This include blood pressure, diabetes, insulin level, glucose, A1C, cholesterol, everything, uric acid, CRP, a marker of inflammation. So obesity is strongly associated with this, with all these risk factors, and the message of this is that to control this risk factor is absolutely essential to reduce weight because weight is the cause of many of these disturbances. Here's the prevalence of blood pressure categories, and in red is high blood pressure, defined as more than 140 on 90. I remind you that it's already a very high setup. Normal blood pressure is much lower in modern guidelines. But anyway, you can see that around 30-40% of people, as we saw earlier, have high blood pressure. But what you can see, of course, it's increased a lot with age. And at the age of 55 plus, the prevalence is around 60 or 70%. Blood pressure more than 160 on 100. This is very high blood pressure, very high cardiovascular risk, stroke and heart attack. And you can see they are around 6 or 7%. An increase with body mass index, again, it increased with age a lot. So these people are really much too high. They need more treatment, or maybe they just didn't take the treatment, which you observe very often. They have a treatment, they just don't take it. And inversely, those in green here are normal weight, defined as less than 130 on 80. And you can see that, again, inverse relation with, among older people, there are very few people with normal weight. Again, with the same thing will apply by socioeconomic status and body mass index, same finding as before. Just some characteristics among individuals treated for high blood pressure. First, 80% of people with hypertension are treated in government health services, 20% in private, and few in both. Question, are you followed by same doctor often or always? Here we can see that in government only 20% say they are seen by the same doctor often or always, which is a problem because for chronic disease you would like that people are seen by the same patients over time. That's important for patient-doctor relationship. In private practice, as we would also expect, this is much higher, 80%, so it's much better on that aspect. A very good news is that many people with hypertension have an automatic blood pressure device at home. And we know that it's much better to measure blood pressure at home by the patient themselves than measure blood pressure in the health center. In the health center, very often is too high, artificially too high. And when they come back to home, the blood pressure can be normal and decrease. So that's a very good news. So this allows patients to have a proper assessment of their own blood pressure. And here are questions about whether they know one or two values for their own blood pressure or for normal blood pressure. And irrespective of whatever they say, whether it's true or whether it's right or wrong, just around 50% of people cannot tell any number. Normally people know how much money they have in a bank account. They know how much money they have on the phone bill, but they don't know their blood pressure. While blood pressure is by far the leading cause of death worldwide in Seychelles. So they have a poor knowledge on what is very important to them. It's their own health. And of course, when you don't know your blood pressure, it's quite likely that people will not make much effort to reduce it because you don't care of it at the first place. So why would you care to take measures? So that's something that clearly has to be addressed further with this kind of programs, know your values and these kind of things. Also, many people do not know that blood pressure do not cause symptoms. They think that blood pressure causes symptoms, which is not wrong, which is not right. And that's also important because if you think blood pressure causes symptoms, if you don't have symptoms, you say, well, everything is fine. Well, it's not fine. Blood pressure does not cause symptoms, and that's a reason it needs to be measured and treated. So also this has to be redressed through awareness campaign. And how long should a treatment be taken? Around half people, that's a general population, think it can be taken just weeks or months, while it should be taken for years. And also that's very important to take treatment, because if you think you take a few days or months, that is over, then of course you will not add it to a treatment over time. So again, these kind of things can be addressed through proper awareness campaign. Here's the prevalence of so-called pre-diabetes, called in medical term impaired fasting glucose, and diabetes. Diabetes is type 2 and type 1, but most cases are type 2. Just to show, we showed the result earlier for diabetes. Now you can see in a range, this is pre-diabetes, that there are as many people with pre-diabetes as people with diabetes, making that at age here 55 to 74, there are around 60% of people who have a problem, diabetes or pre-diabetes. And both these cases should be treated by lifestyle intervention, but also by medications, both, inclusive impaired fasting glucose. Again, an inverse association with socioeconomic status, more diabetes in low versus high, and more diabetes, much more diabetes in those with high versus low body mass index. Again, this is absolutely known since long, and again, this emphasizes the critical role of large body weight for all these risk factors. Here's the prevalence of total cholesterol, which I showed earlier. Just again, 50-60% of people having a high blood cholesterol. Again, many more with age. A little bit of an inverse relation with socioeconomic status. And again, very strong association with high weight. So again, the critical role of weight control. And what is interesting, quite a few, this is 4 or 5%, but that means 4,000 people in Seychelles have a cholesterol more than 7.5. This is extremely high cardiovascular risk. And maybe some of these cases might relate to genetic forms of hypercholesterolemia. There are good news and bad news here. The good news is that most people who have high blood pressure and diabetes know about it, more than 80%. So in some way, no need to make more education about this because they already know. That's fine. 80 or 90% of people with high blood pressure have had these risk factors measured over the last 12 months. That's also a good message because it means that screening is done properly. No need to go in streets everywhere to make additional screening. People know when they have this value too high. Now, are they treated? Yes, they are treated. Again, around 80% are treated. Those who know that they have these risk factors are treated. So all good up to here. Now the problem is here. Among those treated, only 30 or 40% are treated to the target, meaning things could be better. If they were treated better, they would have lower risk. So this is a bit of a problem, and this is found in all countries. Actually, these figures in green are rather better than in other countries, and control is no different than in many other countries. It really shows the difficulty to treat chronic conditions because it's difficult, it's long, you need several treatments, but also because people have to take the drug, because if they don't take the drug, you can do whatever you want, it will not go down. So this really shows an issue that is something we should think of how we can improve treatment in general, and I will give a few suggestions later on and make sure that people take the drug. So here it's the prevalence in the total population taking selected number of medication for three things: high blood pressure, diabetes, and high cholesterol. Only, nothing else. And you can see here the prevalence. So the proportion of people in the population is not among sick people, it's among healthy people, or in the total population. You have in violet, here let's put it in the total population, you have 2 or 3% of people who take 6 to 9 in violet, and in light violet is 5 drugs and solo. So you can see that with age, here, almost everybody takes drugs for these 3 conditions, and many of them take at least 4 or 5 drugs for these 3 conditions, which, by the way, is normal. There's no problem with this. This condition need many medications. And also, you see it's increasing by socioeconomic status. So people of low actually it's low here, people of low socioeconomic status take more drugs. And it's a good news because it shows that between brackets, the poor have access to the health care, which is clearly not the case in many other countries. So at least we have a universal health care system that functions pretty well. And by BMI also, again, the more heavy, the more drugs. And again, because those who have excess weight also have more high blood pressure, high cholesterol, and diabetes. Now, if you calculate the price just based on this data here, assuming a cost of 20 cents per pill for all the drugs for these 3 conditions, which is quite okay to assume this, then you can assume, you can calculate that the total cost just drugs is 6 million. Then you have to add laboratory, staff, premises, and everything. So you can see how heavy in terms of economic cost this chronic condition can be. How many people get screened for cancer that are advised sometimes to be screened in the population level. And the pap test for cervical cancer is done pretty well, as you can see. Breast palpation, 50%, well, that's... And mammography, X-ray of the breast, is done in around 40% of the population aged more than 45 years old. And the PSA is done quite often as well, and colonoscopy is done in less than 15% of cases. So let's not jump to conclusion. People would say, wow, this should be better. But before doing anything, you have to think very carefully. It costs a lot of money to do this screening to many thousands of people for the benefit that is not always incredibly high. We ask people to tell if they see the T state as good or not good. So just 8% report it's not good, which is pretty good, I think. So it means that Oral health is pretty good in Seychelles. Having less than 20 natural teeth, 14%, larger in elderly. Again, pretty low. Again, it's pretty good finding. Denture, 30% in female. Again, pretty fine. Of course, in the future it will be less than this, but those who have a denture now are age 60, so they were born in the 60s. So it's a very old time. So again, that figure is not that bad actually. Chewing difficulty, 14. That's a bit more concerning. 40% say they have chewing difficulty, and that was bigger in young than old. And we don't know exactly why, and we will really ask dental services to inquire exactly what is going on there. Teeth brushing less than 2 times per day, only 8% of females and 30% in males, and more not brushing among young than old. And that's obviously a bit of concern because it's important to brush teeth when you are young, to not have decay. When you are old, when you have lost your teeth, it's too late. The last one is distribution of medical visits for any reason, not just NCDs, to government services and to private health providers. Here it's government services, here it's private services. The quick message is that 70% of individuals aged 18 to 74, inclusive young people, attend a government health services in the last 12 months. Very high number, very high prevalence. For private, it's 50%. It's also quite high, actually. And 83% attended either private or government during the last 12 months. And when you look this by age, you see differences, but not so big. And it's quite interesting. I would expect that it's all who go all the time to health services, but actually not. There are also quite many young people. Other areas assessed, but not shown here, is other things about cardiometabolic risk factors, about carotid atherosclerosis, that is plaques in these arteries, which is a very strong cardiovascular risk factors. Chronic kidney disease, we have measurement of the glomerular filtration rate. Physical inability and pain, that's quite interesting also. That is not it's not killing people, but it's causing a lot of burden, a lot of dissatisfaction for people, and also a high cost, because they are the people who always come to health center because they have a pain here, and they come again and again to ask for something, and most of the time you just give them treatment. But that's a very important aspect that also need to be reviewed quietly. We also measured psychological distress symptoms. What was interesting to see overall is that young people had more psychological distress than old people. And that's quite interesting. Is it problem? Health have problem facing the world, economic situation, challenges of work, couple, whatever, and old are more resilient? Don't know. We don't have the answer to this, but we have the data on this. Moving forward, what can we say for moving forward? The number thing I would like to say is that a survey does not inform on what to do. A survey gives facts and that's it. What works is another issue, and especially what is being implemented is a further issue. It depends on many other things. But just to say a few generalities about this. First, WHO has produced so-called best buys. There are around 20 of them, and so-called recommended intervention. So basically there are 80 of them, and it would be good to first focus on these 80 rather than come up with all kind of other intervention, because these ones are cost-effective, affordable, scalable. There's a WHO Global NCD Action Plan. It was up to 2025. It has been extended to 2030, and is still fully valid and gives a very good guidance, a very good plan. It's not too long. It's very interesting to read and to inspire what to do. And there is a Seychelles NCD strategy. We have the document here. And it's largely inspired for the best buys and the global action plan. The reason I mentioned this here is that this document also is supposed to end in 2025. It's still fully valid. Nothing has really evolved. No new logic has been obtained over the time. It's a strategy, it's not a plan. It tells you a menu of things to do. It doesn't tell you what to do and when. So again, when you look at all these documents, we know what works. We know what to do. The question is to implement. So also we have to realize many Best Buys tend to oppose commercial trends, this new tax, this restriction of advertisement and these kind of things. And therefore we need strong government action. Otherwise you have NCD driven by commercial interest. People will drink more, they will have more sugar drinks and these kind of things if there is no strong government action for this. So we need to set a few priority intersectoral interventions, not 100, not even 20, but 5 or 10. Just what we will do over the next 3 or 4 years, but do it seriously. And make sure that we make agencies who implement them accountable, come with results and monitoring. So who also advises to set a high-level multisectoral body, multiple sectors to kind of oversee what to do and advise, not executive, but advisory body, to try to keep this aspect from multiple sectors and not just the health sector alone. Now, in terms of priority intervention in the whole population, these are interventions that would reduce risk factors in the whole population, whether healthy or not healthy. So the first thing to say is most of these interventions are in various sectors. Again, not health sector, but other sectors. Tobacco use, so it has decreased, so it's a good news, but it could reduce further. And certainly there's a space for further increasing tax, which is high in Seychelles, but not that high, actually, and lower than what WHO recommends. And introduce plain cigarette packages, boxes that are white, just write Marlboro, black on white, finished, no red, nothing. And the same thing, of course, would apply for my cigarettes. Electronic cigarettes, so something is coming, some new regulation is coming to allow them to be sold in the country, which is good. But what should be done is to ban single use, ban those that you buy and throw away, which are very attractive to kids. And the same thing for flavor. There are all these cigarettes that smell the banana, the vanilla, whatever. And they use this cigarette not for the nicotine, but because of the banana flavor. And then they get hooked by nicotine. So it's very important to regulate this properly. In terms of diet, there are favorable trends. There are quite a lot of fruit and vegetable intake in Seychelles, more than in many other countries. And quite unfavorable as well, that is sugar drinks, ultra-processed food, and so on. So there is a need for fiscal and trade policy to promote the availability and affordability of healthy foods, particularly fruit and vegetables. There's a need to limit or ban advertisement, promotion of unhealthy food. All the junk food should be banned, should not appear on television. Sorry, cutting your revenue, but still, this is really important that we cannot have mixed messages. You have publicity on TV at the time kids look at TV, they say, eat this kind of gonas, comme on dit en Creole. And the other time they go to school and the people or the parents say, don't eat this. So there is really ambivalence, ambiguity, and that should not be the case. Reformulation, there's ways to produce food with better content. That's manufacturers to do this, but this need a regulation. You have to say this product must contain no more than this or more than this to be allowed. A ban on trans fat, that's kind of technicality, but a very important measure. For alcohol, clearly a need to ban or limit advertisement, promotion, and sponsoring. It is fully promoted in Seychelles, inclusive sponsoring everywhere, and this is really not compatible with the proper public health, aiming at controlling alcohol intake. Physical activity, difficult you cannot chase people to make them make exercise, or it doesn't work long. So what is good to do is to develop an environment that enable people to do that exercise. And certainly there's many opportunities and space, typically around Victoria, to have cycling lanes, inclusive electric bikes, have more bus lane. When you do this, people have to walk. Obesity, there's a need for education or for everything, inclusive about, as we said earlier, the proper social norm. And the last, selected priority intervention for risk factor control at the healthcare level. Now here we are talking on the Ministry of Health. So there was this low control rate for blood pressure, diabetes. So electronic medical files are absolutely crucial. It's the only way to have a good approach of people over time, and not repeat and know where information stays. And this electronic medical record can be set to put warnings to doctor when somebody is not controlled. And it can also emit warnings to patients. Like when you have your phone, you have no credit on your phone, you receive a warning, you can have exactly the same thing. Your blood pressure is not okay. And you can also monitor actually the performance of healthcare, and that's not the least. More task sharing. Nurses can do quite a bit of the work of doctors, and that has to be a conversation about how to do this in the best ways. Better follow-up by same doctors. Again, electronic file would help for this. Reliance of home blood pressure reading, machine at home. This, as we said, it was quite good already. Education, know your values. And polypharmacy, used for polypills. Polypills are pills that contain 3 or 4 drugs in only one pill, so the patient is not overwhelmed to have 9 envelopes to open in the evening, just open 1 or 2. And pill boxes also can be quite useful. This is boxes where you put what you have to take every day. Obesity, so we have seen this main problem of obesity and its main impact on risk factors. And we also know very little impact of behavioral intervention. Most of them fail. People regain weight after 1 year. So there are now medical treatment. There's also surgery, but there's new medication. So they are called GLP agonists that very effectively reduce weight and also reduce blood pressure, diabetes, high cholesterol, and cardiovascular disease risk. And in quite a lot of cases, they can even result in blood pressure and diabetes remission. So this is very good to think about it because it costs to have this drug, but at the same time, you may not have to treat diabetes anymore, at least for a few years. Cancer, a need for a national screening program to know which cancer to screen, when, and which method. So this has to be thought very carefully. As I said earlier, it costs a lot of money, so you have really to be careful, but that can be well done. It can be quite useful. Oral health, it's not to me to say too much about it, but the different officers in the health services have told me that what is really needed at some point is a national oral health program that can set the priorities right.
Et dans le plan régulateur postal pour introduire un système code sac la case dans le pays, il y a une adresse spécifique. Ça est parmi plusieurs nouveaux mesures qui peuvent être introduits pour moderniser le service la poste et le service courrier dans le pays. Dans une conférence la presse, le chef exécutif régulateur postal Nedi Padayashi a expliqué comment le service postal peut continuellement changer dans le pays.
En 2023, nous avons en révision de la loi pour ce secteur. Et aussi, nous avons introduit une nouvelle régulation pour le service courrier. Ça est nécessaire à cause de ce secteur lui-même, il devient plus compétitif. Et il en a un shift total. Comme dans le passé, quand nous voyons plus late qui peut gagner délivré, comme là nous voyons pour dire on a plus parcelles qui peut gagner délivré et beaucoup plus parcelles qui peut être dans le pays. Si vous regardez l'annual report 2023, il montre pour dire il y en a environ 400 000 parcelles qui sont entrées dans le pays en 2023. Ça, il représente l'augmentation 100% comparé avec 2022. Et là où l'augmentation, il indique qui quand c'est pression, il y en a dans nos services postaux. Et en prenant compte ça, nos services postaux et nos bonnes courriers services, ils ont besoin d'assister, ils ont besoin d'adapter, ils ont besoin d'innover. Et en même temps, le gouvernement a besoin de faire pareil. C'est pour ça, raison que le gouvernement a besoin de venir avec un bon plan stratégique qui moyen pour faire face avec sa bonne augmentation. It's not all bad pour pays à cause il montre pour dire commerce il peut développer et nous avons besoin d'accommoder. Là où peut en bas la loi postal secteur il fait provision qui secteur postal avec bon courier service il gagne licence et ça y a quelque chose qui pas jamais déjà gagné fait dans le passé et lately nous sommes capables de travailler un licensing framework qui aujourd'hui nous voit qui tout ça bon courier service avec service postal et pour gagner la licence très bientôt. Vous tout fini soumettre toute l'application et très bientôt vous pour gagner la licence. À cause de ça, à cause de besoin, nous besoin de la transparence dans sa secteur et pour faire les plus compétitifs et aussi il promène il peut attracter beaucoup de international partners, international business sur les côtes beaucoup. Il monte l'intérêt pour les autres venir faire business, c'est ça. Là, nous pouvons la quantité parcelle qui monte. Par exemple, si on prend novembre, 10 novembre l'année passée, nous avons à peu près 100 000 parcelles qui sont entrées dans le pays. 10 novembre. Et ça a montré qu'il peut mettre une pression énorme. L'eau, nous avons un service qui nous peut donner airport, le service cargo terminal, et aussi service qui customs peut donner. Et c'est pour ça, raison qui nous besoin d'un bon plan stratégique pour ça 3 ans qui peut venir. Là nous fait forecasting pour ça premier 6 mois qui nous là-dedans, nous pouvons voir pour dire ça chiffre il peut augmenter comparé avec l'année passée. Ça école pour gagner cassé ça l'année souri. Un bon premier quelque chose qui nous peut imaginer c'est dans nos plans stratégiques c'est mettre nouveau facilités en place côté ça bonne parcelle il peut entrer. Par exemple aujourd'hui là on peut get la poste c'est que nous bonnes courrier operators autres l'endroit que peut faire ça bonne fonction sous les pangains design, pangains préparés pour accommoder sa quantité parcelle qui peut entrer. C'est pour cette raison que nous pouvons introduire, nous pouvons venir avec un nouveau IMPC, International Mail Processing Center, au Bois Airport. Côté il pour paquet pour tout ça service postal qui peut gagner faire et tout ça process courrier qui peut gagner faire côté cargo terminal il pour booster dans sa nouveau warehouse. Et li expecté gain terminé bonne l'année prochaine. Il peut équiper avec bon automated machines, il peut multitask et aussi nous peut target pour 24/24. Nous pouvons faire ça aussi avec nos bons partenaires tels que SHL, SCA, Customs, la poste lui-même, la police et département trade. Et l'autre quelque chose qui est warehouse pour mener même les parler nous peut dire pour développer commerce c'est pour attaquer aussi bonne grand la compagnie par exemple nous on a bonne la compagnie tel qui pareil Amazon qui ont une exprime ont l'intérêt pour autres venir cesser là et nous on a bonne grand la compagnie aussi from India UK US qui exprime autres désir pour venir faire business c'est et nous welcome ça bonne idée à cause par nous peut amener plus compétition il développe e-commerce et aussi pour faire un traders aujourd'hui là nous peut guetter nous par nous dit 400 000 parcelles qui notre CC mais par contre nous nous à peu près 14 000 parcelles qui sont sorties CC là on peut gagner des autres services qui peuvent CC par exemple Amazon il peut donner l'opportunité de business CCLOA pour vendre d'autres produits à l'étranger. So, avec ça, il peut mener l'autre aspect développement de l'économie sur lui. Et nous, c'est ça, bon secteur qui nous peut targeter. Et ça, International Center aussi, nous peut targeter pour venir pareil, un transit hub, côté nous capables faire business avec les autres continents, pas tel que le continent de l'Afrique et aussi l'Asie. À cause nous connaissons le côté bien placé pour les venir hub dans la région. Vu qu'il là, nous avons un Sud-Afrique qui tient un hub, qui est fermé, là, il nous donne une bonne position pour nous prendre sa place. Et les autres choses qui nous permettent aussi, c'est un National Addressing System. Ça nous entend cause de là souvent qui aujourd'hui là on peut gagner une quantité mail une quantité parcelle qui fait pas gagner il pas arriver dans sa destination aller à cause nous n'a pas un proper addressing system et beaucoup services à l'étranger ils pas envoyer autres parcelles c'est là nous pouvoir individuellement puis faire son shopping online il peut dire pas ship c'est une bonne raison primordiale, c'est à cause nous n'avons pas un National Addressing System. Et prenons compte qu'il a aujourd'hui nous halfway le National Addressing System qui très bientôt nous présente nos papiers dans le cabinet. Et je peux voir que bientôt chaque dimanche pendant son adresse unique. Il pour un standard international. Écoute bientôt les dimanche pour faire son shopping online pour n'a pas un pays qui peut dire qu'il n'est pas capable de livrer ceci. So, ça c'est quelque chose qui nous peut forecast, il a un plan stratégique qui nous envie emmène devant pour le développement e-commerce et aussi pour plus de compétition. Aujourd'hui, nous avons un service postal à cause de designated service et la loi fait provision pour nous dans ce service courrier, nous avons 3 main services courrier qui existent, Cécile. Nous avons My Shipping, nous avons DHL qui est en bas l'opération Handel et nous avons FedEx qui est en bas l'opération Essentials. Et pour le moment, c'est même ça 3 services qui n'appliquent pour licence.
Moi, d'abord, pour un courier service qui peut délivrer ça, quelque chose pour updater le système mapping qui nous avons, pour Google Maps, ça quelque chose capable là-dedans pour faire du facile.
Sa National Addressing System, nous pouvons travailler avec Universal Postal Union overseas qui peut nous quantité de la site in regards to technology, digitalization. Nous pouvons dire un système pour parler et pour un remapping sur les. Ça remapping qui nous presque arrive la moitié semaine. Qui n'est pas pour bénéficier des services postaux avec courrier, pour bénéficier aussi les autres agences, par exemple, disons utilities, puis aussi la santé, l'ambulance, quelquefois, et puis il arrive côté l'endroit. Si il gagne l'adresse, il peut mettre l'OSA apps, il peut conjecter mon côté pour venir. So, il peut bénéficier de différentes agences. C'est même ça que nous pouvons travailler ensemble avec les autres agences tels que local government, planning MLH, land transport, biostatistique, même bioélectoral. So, pour nous gagner bien, et qui est une façon qu'il est sorti, le pays entier va bénéficier. Nous pouvons expecter un pilot plus tard dans l'année ou bien est capable plus tard dans l'année ou bien bonner l'année prochaine, mais c'est son rollout lui-même il pour bonner l'année prochaine.
Et pour individuel, ça un système d'adresse là ou bien pour par famille, par household?
Ça système d'adresse pour le moment qui nous pouvons envisager faire c'est pour par household, je peux voir qui bientôt tout le monde prend son house number. Qui ça y est quelque chose qui accompagne nous peut travailler avec Universal Postal Union, mais il dépend how feasible nous mettre en place, nous faire ce pilot study, how feasible it is, mais seulement il pas peut exister que des dimoni pendant même l'adresse à cause ou pendant un seul nom, un seul scientifique et un seul house number. Et bâtiment aussi pareil. The National Addressing System is comprised of deux parties. So, premier part est the national addressing lui-même. So, deuxième part est the postcode. So, pour gagner l'adresse, qui nous peut travailler avec UPU, le standard S42 international, et pour venir l'adresse, qui a un national addressing system ensemble avec son postcode. So, ça veut dire que même pour augmenter, mais avec sa postcode qui nous a, et pour faciliter pour nous continuer le mode du monde et l'adresse.
La compagnie courrier principale, est-ce qu'il y a une place pour les autres? Après, on nomme nos bonnes qui peuvent entrer à Maison, les autres bonnes grands. Est-ce qu'il n'y a aucun engagement qui définitivement les autres peuvent venir et les autres peuvent venir pour les autres même ou bien les autres peuvent associer avec sa bonne la compagnie locale?
Pareil, nous connaissons un secteur courrier, un secteur qui est ouvert dans le market, sur n'importe qui. Business qui vient investir sur le secteur courrier est capable de faire lui. Mais seulement qui nous peut voir pour les moments quand même nous peut gagner bonne grande la compagnie qui vient investir c'est et nous déjà une bonne grande la compagnie qui peut investir c'est par SPDAF. So il y a grande la compagnie mais c'est moi je pas venir nous autres même nous pays partners avec bonne la compagnie locale et ça y a quelque chose qui nous supporter. Mais seulement, nous besoin pas encore pour dire un secteur qui est ouvert, sa compétition est pour là, sa compétition est pour exister. Et là, nous finissons faire ça nouveau warehouse. Nous désormais c'était l'engagement avec bonne grande la compagnie pour autres venir investir, Cécile. Qui nous peut voir pour le moment, c'est quand même nous avons ça bonne la compagnie. Quoi qui peut empêcher d'autres investir Cécile, quand même nous connaissons pour dire Cécile marketing, bon, c'est soit shopper quantité online, basé sur sa limite qui nous a 3000 roupies, qui y a une bonne limite plus haut dans le monde sous les. Existe qui a bonne la compagnie, probablement pas associer les autres avec bon service qui pas pour mettre les autres standards ou bien les autres demandes, à cause pour le moment nous pouvons ça bonne facilité. Mais là, nous prenons un centre au niveau international qui peut gagner crédité par UPU, le niveau international. C'est définitivement ça bonne la compagnie pour donner nous l'engagement pour les autres venir investir. C'est là. À cause, pour le moment, c'est de les autres espérer. Si ça centre là est paré, ça centre gagne crédité et là, pour les autres, comment les autres fonctionnent.
E por isso, em warehouse, que tipo ganha store, ben parcels, ou põe collection point aussi, que o cliente vem ser.
Ça International Mail Processing Center, e pour un warehouse que pour collecter, et pour faire sorting, et pour faire delivery. Seulement, là, nous pouvons dire delivery, il peut un delivery point, que ça va courrier, la poste, pour prendre un centre, pour délivrer devant la porte. On n'a pas oublié qu'il y a ça SI56 qui est sorti l'année passée, cette régulation, qui fait provision pour d'autres services. Et nous avons demandé pour servir bien ce service d'autres. À cause que nous pouvons avoir beaucoup de monde qui peut en appel, qui peut courrier, nous tous nous comptons, nous passer, nous venons dans la aujourd'hui même. Mais seulement, nous avons déjà fini de payer pour ce service d'autres. So, ça courrier, sont l'obligation pour dire même que tout. Et justement, basé sur le licensing framework qui nous fait sortir, nous pouvons beaucoup plus sévère avec bon service courrier et aussi même service la poste. Si vous n'avez pas délivrer ce service ou bien standard qui nous met quantité de temps qui ont besoin de délivrer au parcelle dans nos bonnes fines qui ont été en place. Qui avant nous pas faire à cause nous n'avons pas une licence. Mais là, nous avons une licensing conditions, nous avons une licence qui ont une bonne fine qui ont été en place. Si nous voyons pour dire que sa client est supposé gagner son parcelle de 3 jours, il ne peut pas gagner. Soit sa client est supposé finir gagner son parcelle, côté lui, ça la compagnie peut dire c'est là-bas de place qui délivre sa parcelle côté lui. Le licensing framework, ça courier service en 3 jours pour délivrer sa parcelle. Et maximum 3 jours pour délivrer sa parcelle, les sa parcelle finie arrive dans son possession. Ça veut dire qu'elle finit passe customs, sa parcelle dans son possession, il y en a un maximum 3 jours pour délivrer sa parcelle. Ça veut dire si demain client vient contre nous et dit nous pour dire sa courrier service une colle 3 jours passés ou bien 4 jours passés, sa parcelle pourquoi arrive contre lui et nous find out qu'il y a encore dans possession service sa courrier, là sa courrier service pour gagner fine. Là, nous faisons la licensing framework, nous travaillons avec nos bonnes courier operators, nous ne faisons pas les nous-mêmes. C'est nous prenons maximum le temps sous les qui autres standards, ils demandent à cause d'autres autres international standard. So nous prenons maximum le temps qui autres bons standards ils demandent pour nous tomber en conclusion qui nous capable d'acceptable pour Cécile. À cause pas nous connaissons Cécile, il y a ce type petit pour nous faire délivrer maximum nos bonnes courrier service peut faire ça dans un jour ou bien dans 2 jours. Et à l'exception qu'il y a un grand indilé l'avion que nous pouvons un grand quantité passer les venir, c'est là que nous a ça maximum 3 jours. On laisse une l'exception que vraiment les autres papiers connaissent que ça du monde peut rester. Mais c'est même pas nous peut dire avec the coming of the national adjusting system, il peut retirer ça bon problème pas qu'on adresse.
Par exemple, o cargo qui arrive dans le pays, disons lundi ou bien qui favori de passer, par exemple, si ça l'agence courrier il contacte au mercredi, qui finit passer par 4 jours et puis fait moi il va quoi il vient à peu près 10 jours là mon pégueté non?
Usually là ou passer l'entrée dans le pays si taxable ou bien il y en a un bill au 28 pour faire ça veut dire dépasse la valeur 3000 roupies ou bien 5000 roupies. Ça veut dire qu'elle considère comme un pending parcel. C'est là qu'il y a la possession custom. Et nous mettons en place un service ensemble avec custom, nous mettons en place un service e-payment. Ça veut dire un client qui peut payer custom pour son parcelle, pour son taxe, il pourra pour dire combien là, il peut prendre juste 5 minutes pour lui gagner sa récit, comme quoi il finit payer custom. Qui avant tu peux prendre autres, tu peux payer des jours. Là combien là il prend juste 5 minutes. Et ça veut dire nous respecter qui clearing of parcelle qui pending, il y a beaucoup plus vite. Et là ça parcelle il finit gagner clear. Il y a la possession sa courier operators, c'est là qui notifie sa client pour faire connaître pour dire que ça finit donner sa parcelle de sa possession. Là à ce moment, les notifier où il y en a 3 jours pour lui délivrer sa parcelle koto, un maximum of 3 jours. Nous connaissons pour dire majorité nos bonnes courriers puis faire ça dans un jour 2 jours, mais c'est mal là pendant dit un maximum of 3 jours, le temps sa parcelle finit dans sa possession.
Ça veut dire que je peux écouter là, avec le nouveau système, warehouse, que je peux mettre en place, la poste aussi, supposé, peut-être que workload est réduit, pendant moins de congestion, est-ce qu'il est comme ça?
Pas la poste. La poste, côté était quantité partielle qui peut gagner, ça la doit pas convenable pour le travail, sa quantité partielle. Et c'est ça qui, tout ce bon service, in regards to recevoir, sorting, avec delivery, peut gagner retirer côté était pour bouger là-bas de sa nouveau warehouse. Nous respecter la poste quantité l'état qui peut délivrer parcelle, il peut sortir pour, par exemple, là, si peut prendre à moins 14 ou 15 jours, il peut sortir pour, il peut tomber, pli bas qui 6 jours. Ça machine qui nous permet, qui nous peut façon qui nous peut digitaliser sa centre, c'est by the time ou passe il vient bon matin, within 2 jours, il finit clear ou parcelle. So within 6 jours, si ou parcelle il vient par la poste, ou bien moins ou bon finit gagner ou parcelle. C'est ça façon qui nous envisage faire de sa nouveau warehouse. À cause la poste, il peut aller à un niveau côte, il peut capable compter avec bon courrier pour à cause, ils peuvent servir même machine pour que les autres parcelles. So pour n'a pas sa distinction présent.
Ça c'est concernant service courrier, c'est nous dernier sujet dans un programme News Extra. Joignez-nous semaine prochaine pour un autre programme. Merci pour suivre.